press briefing, so we'll go ahead and get started. Good afternoon. I'm Christy Campbell from the Cobb County Health Department. Welcome to our weekly press briefing where we talk about all things COVID. I'm still happy to report that for Cole County, we are seeing lower positive case numbers. I'm sure the hospitals can also share that they have been seeing lower hospitalization numbers. We have still been working quite closely. We talk at least twice a week about the vaccination status in our county. We talk about who has supply, who will be getting vaccine, who needs vaccine. And I assure you, there's a lot of behind the scenes work that goes into making sure we are all doing what we can to serve the eligible populations for vaccine. We're all doing a lot of consulting on who is eligible. We access that list and talk about that. And we are trying our best to assist the groups that are not eligible yet in getting on the proper list and finding vaccine for the groups that are eligible and making it accessible. I am very pleased to report that the data that we were provided as the regional implementation team supported the request for another Missouri National Guard supported event in Cole County. And I'm very pleased to announce that that event will be March 19th at the Link again. We are very thankful to the city of Jefferson and Lincoln University for the use of that facility. It worked very well for our last event, and we're very happy that we'll be able to use that venue for our event again. We are happy to report that because the governor is activating Tier 3, Phase 1B Tier 3 on March 15th. Cole County school staff, all school staff from public and parochial schools will be given the first opportunity to sign up for that event on March 19th. And then the remaining slots will be filled from lists or from people that are eligible in Tier 1, Tier 2, and Tier 3. We're still working on those details, but we want to offer that school staff the first opportunity to sign up for the spots for that vaccination event in Cole County. With that, we will turn to Dr. Haight at Capital Region Medical Center.
Hello, everyone. As Christy has said, the hospitals continue to have a low number of patients who are positive with COVID. Over the last 3 weeks, we have had less than 5 patients each day in the hospital. And this morning, we had 2 patients, neither one who were in the ICU. So again, we see a decreased number in the hospital. And as Christy said, we see a decreased number in our service area. Capital Region has an 8-county service area, and that rate of positivity over the last 10 days. So those testing positive are at 0.6 per 1,000 people within those communities. So that continues to go very well. I just wanted to remind people there are 3 vaccines available. If you ask any of us health providers, we will tell you if you are offered a vaccine, please take the vaccine that we have available. We currently have Pfizer, which was the original vaccine that was given emergency use authorization by the FDA. The week after, we had Moderna. Pfizer, again, is a 3-week interval between the first and second shots. Moderna has a 4-week interval between the first and second shots. Most recently, within the last week or so, we were able to now have Johnson & Johnson approved. It is a 1-shot dosage, and so again, that is available. I will tell you at each of our institutions, we are given whatever vaccine we are given, and it has changed from week to week. So we have received Pfizer here, then Moderna, and next week we'll receive Pfizer. And so as we work together in our region, we are trying to, as Christy said, behind the scenes, get as much vaccine to people within our region, the vaccines, so that they can continue to vaccinate the public and the patients who are qualifying. So that's just a little bit about the vaccines that are available. In the future, there will be vaccines that will be approved, but these are the 3 that we are working with at this time. Thank you.
Thank you, Dr. Haight. Dr. Adams from SSM St. Mary's.
Good morning. Likewise, we continue to see low numbers of positive COVID patients especially who require admission to the hospital. So we are pleased with that. Still want to continue all of our safe behaviors. As a Catholic institution, we have received a lot of questions on the ethical and moral concerns surrounding the development of the Johnson & Johnson vaccine, which was developed using a cell line from aborted fetal tissue. There was a statement put out by the Archdiocese in St. Louis, which you can get access to read it for yourself. But essentially, it does say that the conclusion of the statement is if you're not offered any other vaccine, that it is acceptable to accept the Johnson & Johnson vaccine. If you're offered a different one, then you're advised to take a different one. But as you know, there's a supply and demand issue in our region. So we're not at this time able to offer which vaccine you want to choose from. Perhaps in the future that would be an option. But I think it is prudent and you could, with good reasoning, decide to accept the Johnson & Johnson vaccine as recommended by the Archdiocese of St. Louis. Thanks.
Thank you, Dr. Adams. Dr. Sullivan from the Community Health Center.
Yes, I'm going to try and share my screen here to go through the Vaccine Navigator website. So let me see if I can get it to work. Can you see my screen?
Yes.
Okay.
Yes.
So we had talked through this once or twice before, but we thought maybe it would be helpful to actually see it, see how it works. There's a lot of great information on this website. So if you go to covidvaccine.mo.gov, you can find all sorts of information related to the vaccine. So if you go to the tab called Residents, there's a lot of information, general information. It goes over events that are happening, priority phases, so you can find out kind of where you're at if you're not sure on those phases. You can also find, if you go to Get the Facts, that can give you information on safety data. It has information on common rumors that are addressed. You know, questions that people have, frequently asked questions. You can find that information here all in one location. It goes over the different rumor controls. So some of those questions that you see or people ask, you can find that information here. The other area I wanted to show was if you want to try and register for one of those events that is happening, you can go to Register Now, and that'll take you to the Vaccine Navigator website. So if you do not have access to the internet, you can call this 877-435-8411 number, and you can get signed up that way as well. So once you get to this Navigator website, you would click on the Register Now, and that will prompt you to another page. If you have any questions before that you begin that process, you can look at each of these steps. So if you're at step 1 is that registration step. So this is where you would sign up. And so you can kind of look through it. It tells you exactly what to do. You complete the online form. This form will also help identify which priority phase you are eligible for. It'll ask you some information about your medical history, and it'll also ask for contact information so that when it is your time to make an appointment, they'll send you that information. So they have to have your contact information in there. So you would initially register. Then the next step would be when it's your turn to make an appointment, you'll get a text or an email from this system. And like they said, it will take a few weeks or months to get through this step just because of the limited supply. And then it also explains what will happen once you make your appointment and what you need to bring for those appointments. So it goes step by step exactly how to do this process. It also goes through frequently asked questions here as well. So if one of the questions we see a lot, if there's no appointments on that page, then you need to just continue to look for new appointments that are added every day. So you can kind of see what's available in our area. Again, supply is very, very limited, so you may not always see something there on that page when you first look at it. So I kind of just wanted to walk through that. The other thing that's available is if you speak a language other than English, you can translate this page to whatever other language that you have. So if you need it in another language, that is available as well. So I just kind of wanted to walk through that process. So let me see if I can stop sharing. And that's all that I had for this morning.
Thanks, Dr. Sullivan. That was great info. And of course, that's if anyone is interested in the mass events, mass vaccination events. You could always still contact your doctor first to get on the list there. And of course, the health department as well. So Ron with JCMG.
Good afternoon. So JCMG, similarly to Capital Region and St. Mary's, is continuing to see a decline of patients that are seeking evaluation for COVID symptoms and the associated testing. So we think that's fantastic news. We've also got a dedicated phone line set up now for our COVID vaccine clinic. Starting in January, when we were first providing vaccinations to patients, it was through the help of many different departments throughout the Jefferson City Medical Group organization that allowed us to provide over 3,400 vaccines in a very short amount of time. And so in the meantime, we've been working in the background to stand up a dedicated vaccination department that will be administering these vaccines, of course, full-time, dedicated staff, and coming with that is a dedicated phone number as well. Up until now, again, we've had different communication methods, and so I'm excited today to provide that phone number in which patients can call if they need assistance in getting on our communication list, if they would need to reschedule an appointment, if they would need to cancel their communication preference because they already have received the vaccine elsewhere. Pretty much any needs they would need from us for their vaccinations. That number is 573-556-7745. And again, we've got that staffed and also available with voicemail if staff are with patients administering vaccines. One of the biggest asks that we would request is that if you have received your vaccination elsewhere and you happen to be on our list or you think you might be on our list for communication, please let us know. We're making a tremendous amount of calls every day. Multiple staff are making calls, reaching out to patients, and we're excited to hear that when we call, a lot of patients have, received their vaccine elsewhere, and that's fantastic, and we love to hear that. What it's doing, though, is it's slowing us down getting to those patients that haven't received their vaccine yet, and the majority of the calls that we're making, again, our vaccination hasn't been received elsewhere. So it would tremendously help other patients in the area if you would let us know that you have received your vaccination. We'll take you off our communication list. Again, you can call that number at 573-556-7745. We'll take you off the list. We're also going to be emailing, should be later on today or tomorrow, patients that have signed up on the communication list, again, asking for a response from them as well, saying if you got it elsewhere, just drop us a quick message or unsubscribe so we can make sure we can get those patients in that have not had the chance to receive the vaccine. We continue to vaccinate this week with our second doses of Pfizer, first doses of Moderna, and we'll be offering the Johnson & Johnson vaccine to patients starting next Monday. Thank you.
That's great, Ron. And I think we can all echo that statement that we're so pleased that people in the community have been receiving the vaccine. But if you're on our list and you received it elsewhere, please let us know. All of our organizations are spending a lot of time calling and making appointments, and we agree it's fabulous when people have received that vaccine, but it would save some of our staff time if you would just drop us a note and let us know. We've got some via Facebook Messenger. We've had people call in, so it would be really great. So if you could just let us know. So Commissioner Bushman.
Well, first, I want to thank, this has been going on for over a year. And our medical alliance, that's what I call this group. We're an alliance now. We're all working together, and it is so wonderful. And now with the start of Tier 3, we have our educators partnership as well, which is our school districts, the parochial schools, the private schools, and they're working together too. So I just, the way we're working together, I am so proud of Cole County, and I'm so proud of all of you And I think, you know, this is just really great. And we are Region F. And if people don't know what Region F is, we're basically using the Highway Patrol troop area. So this is Troop F, the region. So we are Region F. And Region F has been leading the state in the percentage of population vaccinated. And we are leading, well, we've been leading since the beginning. So being able to have these clinics and being able to get the vaccines and everything, I think, as I told Dr. Williams, on the 15th, I contacted them within a half an hour of the governors. And I said, Cole County is ready to have a vaccination on the 19th. Christy was at the link setting up. We had the link reserved. We had the schools all on board. We just needed the vaccine. And I said, we'll be your poster county. And, you know, they bought it. So we are 4 days after March 15th, we are doing a vaccination clinic again. And I want to thank all of our partners here in our Medical Alliance. I want to thank the vaccinators, and we're taking care of our citizens. So I just think, I can't thank you all enough for what you're doing, and we're just going to keep moving ahead, and we will be the poster county for the state of Missouri. So thank you.
Thank you, Sam. Mayor Turgeon?
Thank you. And I would agree with Commissioner Bushman in showing our appreciation in such an organized way that our partners have all come together to make this happen. And here's what we really need from you is we need everyone to share this information. We need people to share, especially the information that Dr. Crystal Sullivan has shared with us on this call about the covidvaccine.mo.gov and all that very helpful information. So as we know that these press briefings that we do every week are also streamed on our Facebook page, City of Jefferson, Missouri Facebook page in the afternoon of our press briefings. So be sure to share that. And also Cole County Health Department has been placing lots of helpful tips and information about this on their social media, on their Facebook page as well. But it's important for us to share that information with others and our friends and family. So I'll say that that is an ask that we have of you. That you are viewing this, to share this information with your friends, family, coworkers. Of course, sharing it from a distance and keeping that spaced out is still important as we start getting things back together, as we ease back into this, that we need to remember to keep those safe protocols that we've been doing all this time. And also realizing that not everybody might be getting this information. They may not be on social media. They may not see these briefings. So it's our job to really get that out to all of those around us that we interact with. So please share this as much as you can. Check out the website yourself so you have that pertinent information at your fingertips, so that whether you're eligible now or that you will be ready when your time is eligible for the vaccine, and everything else you should be doing in between. So thank you for helping us get that message out.
Thank you, Mayor Turgeon. I received a couple of emails with questions. So I want to address the first question, the second question first, about the March 19th event. We're expecting probably around 2,000 to 2,300 people, because we will be receiving the Pfizer vaccine for that event. So we will be having a second dose event on April 9th. First dose will be March 19th, second dose April 9th. It will be Pfizer. It'll be about 2,300 vaccines. We will be using the Vaccine Navigator system for this event. So school staff will be registering through the Vaccine Navigator system, and then we will send them a code to sign up. Other eligible people should go ahead and sign up through the Vaccine Navigator site. So if there's spots open, which I anticipate there will, we can access their information through that Vaccine Navigator system. The first question that I received is probably more for one of the physicians on the call to answer. And it said that they've been hearing on the national reports from health experts that getting a COVID vaccine will become an annual thing, much like flu shots. So does any physician want to answer that?
I'll start and anyone else can chime in. It's too soon to tell at this point. There are a lot of people that have ideas of what will happen from year to year, but truly it is too early to tell what we will need, whether it will be yearly, whether we'll need any booster So again, those are thoughts and ideas that people have, but again, nothing concrete.
Yeah, they have to do further studies on the durability of the immunity response, and we simply haven't had enough time pass from the time when we first started giving vaccines until now. If it's going to be annual, does that mean it lasted 6 months? Did you have immune response for 6 months? How long was your immune response? And we don't know the answer to that yet. We do know that if you've actually had COVID infection, that the durability of your immunity is at least 6 months. We know that now, but we don't know how long the immune response will last from having a vaccine.
Thank you, Dr. Haight and Dr. Adams. Does anyone else have any thoughts on that? Dr. Sullivan? Okay, so are there any other questions for the group or any other comments that anyone wanted to add after the discussion? Quiet group today, so I'm not hearing any questions. So thank you all for joining us, and I hope you can enjoy this beautiful weather and have a great afternoon. Thank you.
Christy, we will be having a press conference again, right, on the 19th?
On March 19th, we will have a press briefing again at 7:15 before the event. So we'll probably talk about that next week or the week after. All right, thank you. Bye-bye.